Hello, my name is Annabelle Loomis. Sorry for the way I'm recording, but my computer does not have too much storage. But other than that, this is my presentation on kleptomania. So, kleptomania is a quite rare mental disorder where the person affected has the uncontrollable repeated urge to steal, and so it's not rational. They don't have an actual need to have these items or steal them, and many resist the urges a lot, but they still give in, and then afterwards they feel a lot of guilt, and some compensate by returning items or reimbursing the person that they stole from. And kleptomania is also classified as an impulse control disorder. So the causes of kleptomania include, firstly, a difference in brain chemistry and structure. So people who have kleptomania have a difference in their impulse control connections of their brain, which leads to a weakened impulse control. They also have imbalances in their brains with their neurotransmitters, which include dopamine and serotonin. And those neurotransmitters are responsible for mood regulation and rewarding systems. Another cause could be pre-existing conditions. So individuals may be at a higher risk at developing kleptomania if they already have like anxiety or depression or possibly substance abuse issues. Now, genetics, which is the third cause, it's not confirmed that kleptomania can be genetically passed on, but it's seen in the genetic history that people with kleptomania often have relatives who also have mental disorders. So the prevalence for kleptomania is about 0.3 to 0.6% of the general population, which equates to about 1.2 to 1.4 United States people in the United States. Women are also 3 times more likely to develop kleptomania, and in most cases, people develop kleptomania around the age of 17. And then here is a bar graph on the gender percentage of the kleptomania population, with females being a little bit more than 60% and males a little bit under 40%. So societally, many in the past, it's been hard for society to accept kleptomaniacs because they usually see them as thieves or criminals or whatever. But recently, society has been growing and accepting kleptomaniacs as having a mental disorder rather than people who just steal for fun or for the thrill, which has been leading them to being treated more fairly in criminal instances where they're not seen as criminals, but instead they're seen as individuals who are suffering from a mental disorder. Down onto the next page, we have our theoretical perspective. So the first one is the cognitive perspective. In this perspective, kleptomaniacs, this one focuses on the reasoning that leads to stealing, which is the kleptomaniac's beliefs and thoughts. So the rising tension that builds up for kleptomaniacs works along with their intrusive thoughts, which include thoughts like that they're not harming anyone, or it'll make them feel better to steal, or it's not a big deal to steal. And then those irrational beliefs lead them to continue to steal because it reassures them that the stealing is not bad and it justifies it. So they continue to do so. And the second theoretical perspective is the learning theory. So this theory suggests that kleptomania is a learned behavior and that kleptomaniacs learn it through behavioral conditioning. So that stealing becomes reinforced. For example, if someone's stealing something minor out of curiosity, maybe emotional distress or boredom, And then if that feeling is followed by a sense of thrill or relief, then it starts becoming a habit where it's learned. And specifically, operant conditioning takes place when the positive reinforcement, aka the thrill and excitement of stealing, works along with the negative reinforcement, which is the relief of anxiety. They work together to develop and strengthen the tendency to steal. This theory also defines kleptomania as a maladaptive coping mechanism, which means, in other words, that it's learned through a process of trial, reward, and then relief. Another external reinforcer of stealing is the lack of punishment or not being caught. So if they don't get arrested or yelled at or whatever, then they're more likely to continue to steal. And the treatment options for kleptomania include CBT or cognitive behavioral therapy, which utilizes techniques like covert sensitization. An example would be the kleptomaniac imagining the possible negative consequences of stealing, like getting arrested or etc. And another form of CBT is impulse control training. An example of that is the delay and distract mechanism, where the individual, when they get the urge to steal, they do the delay tactic, where they delay the urge to steal so they don't steal, and then by doing that they distract themselves. So they call a friend, or they practice deep breathing, or they go on a walk. And so according to Grant and Potenza, CBT was actually found to have considerable improvement for kleptomaniacs, with a 50 to 60% success rate, which makes it one of the most effective therapies for kleptomaniacs. Medication is also another possible form of treatment. It's best utilized in addition to therapy, but the two types of medications used for kleptomaniacs include naltrexone, which is usually used for substance abuse, but in this case it blocks out the pleasure response linked to stealing. And another medication is SSRIs, or selective serotonin reuptake inhibitors, which include fluoxetine or sertraline. They improve mood, and then they also reduce the urges to steal. Lastly, kleptomaniacs can go to support groups or counseling. This also helps if they have other active conditions where they can just cope with their guilt or anxiety and other issues that they may have with other conditions. Right here you can see a bar graph of the treatments and how effective they are. 60% for medication, about 50 to 60% for CBT, and then around 30% for support groups. Here's some additional information. And then the future directions for kleptomania include brain imaging. So studies have found that people with kleptomania did have those differences in reward and impulse control areas. So updating and learning more about brain imaging can help people learn more about kleptomania and then develop more treatment and more successful treatments. Another future direction are digital CBT tools and mental health apps, which can help those afraid to seek help because of the guilt of stealing or fear that they may be incriminated or whatever. And yeah, it reduces the stigma and increases their access to treatment. And here are my references. And yeah, I apologize again for the way I recorded, but thank you and hope everyone has a great summer break.